next time you come down with COVID-19, you won't have to worry about isolating for a set number of days. Now, that's according to the most recent guidance from the Centers for Disease Control and Prevention. 3 on your side's Brendan Hall joins us now with more information.
The CDC's updated and simplified guidelines even the playing field between COVID-19 and other respiratory illnesses like the flu. The infectious disease expert I spoke to says the change reflects a recognition that COVID isn't the disease it was 4 years ago and that people aren't doing a good job of testing themselves for it anyway. There's no question the CDC's COVID-19 guidance has undergone a number of changes over the years. Baptist Memorial Healthcare's medical director of infectious disease, Dr. Stephen Threlkeld, says a lot of that can be credited to the fact that all of us are learning about the deadly disease in real time.
What's the impact of kids missing school versus protecting the kids against COVID? These aren't easy questions. They're not questions that guidelines can really necessarily keep up with very well, but we have to try.
The latest guidance frees people to go out in the community once they feel better for at least 24 hours and remain without a fever in the absence of medications that can artificially knock a fever out. Threlkeld says the shift is in response to a 90% decrease in mortality, a dramatic decrease in hospitalizations, and a recognition that a lot of people just aren't testing themselves anymore.
A lot of people don't have the coverage at work to miss work, without losing pay. They can't afford to do that. And so what happened was a lot of people just weren't testing. I can't tell you how many times I've heard, well, if you don't test, you don't have the disease. And I hope that'll get around that with less of a penalty, if you will, if you're positive.
The problem, of course, is more people are going to be out and about while still contagious with COVID. So the hope, according to Threlkeld, is that people will go back to testing themselves more, take advantage of vaccinations and medications like Paxlovid, as well as follow recommendations like wearing a tight-fitting mask.
It does, I think, put some of the impetus on people who are at high risk to protect themselves. We do know that that can be done, and we do know that we don't do it well enough.
Once you go back to normal activities, the CDC is encouraging you to take additional prevention strategies for the next 5 days. That includes exposing yourself to fresh air, enhancing hygiene practices, wearing a tight-fitting mask, and avoiding people who are high risk. Brendan Hall, 3 on your side.